Modern clinical trials are relying more heavily on decentralized and multi-site models. This approach reaches more patients, but it introduces a heavy layer of operational complexity. This data on investigative sites tells the story. 11% failed to enroll a single patient, and another 37% under-enroll. These recruitment struggles create a bottleneck right out of the gate. Today, startup delays affect roughly 70% of all clinical trials. The financial toll is concrete. A single day of delay in a Phase 3 trial costs upwards of $55,000 in direct operational expenses. When you accept standard startup delays, you guarantee budget overruns. Those costs pull resources away from the rest of your clinical pipeline. One of the earliest operational choices you make dictates how you handle these bottlenecks: your trial's kitting strategy. The way you package and deliver supplies directly controls your initial site activation speed and the long-term protection of your study data. Sponsors typically choose between two methodologies: standard kitting or protocol-specific kitting. It is a choice between prioritizing sheer rollout speed right now or demanding scientific precision for the long term. Kitting is a core financial strategy. It is the primary lever you have to protect your budget and ensure your trial remains viable as it scales. Standard kitting relies on generic, pre-stocked containers manufactured in legacy batches. The primary benefit is speed. These kits are sitting on a shelf, meaning you can deploy them to trial sites almost instantly. But that speed often leads to lower accuracy. Generic devices frequently clash with specific trial requirements, which raises site error rates. Missing tubes or incorrect swabs trigger a costly cycle. You end up constantly reshipping supplies to sites that are already struggling to enroll patients. Look at this chart tracking inventory. When you batch manufacture standard kits months in advance and recruitment slows, you generate significant volumes of inventory waste and drug overage. That waste translates directly into a cumulative financial loss, draining your budget over the study's lifespan. Standard kits launch faster, but the compounding errors, constant reshipments, and physical waste erase those initial time savings. Protocol-specific kitting focuses on bespoke engineering, tailoring the kits to your exact biomarker and regulatory requirements. The trade-off is upfront friction. This method requires a higher design investment and more dedicated logistical planning before the first shipment goes out. This strategy is powered by just-in-time, or JIT, manufacturing. Instead of building everything months in advance, kits are assembled and labeled just 2 to 10 days before actual patient demand. Moving to a demand-led assembly model effectively cuts your drug waste and overage in half. While it requires more logistical planning at the start, protocol-specific JIT manufacturing is the structural solution needed to protect trial data and minimize drug overage. Comparing methodologies, standard kits suffer high site errors and inventory waste, while protocol-specific kits minimize both. Standard kits launch immediately but cause downstream delays. Custom kits ensure uninterrupted execution. Finally, custom models adapt easily to mid-trial amendments, whereas standard kits remain rigidly fixed. Standard kitting trades long-term stability for short-term speed. Protocol-specific kitting requires an upfront investment, but it results in reliable, error-free execution. Standard kitting may be sufficient for basic, low-complexity local sampling studies. However, if that study evolves or requires a sudden protocol amendment, you immediately expose yourself to significant supply chain vulnerabilities. Contrast that with decentralized clinical trials and precision oncology studies. These trials rely on complex cold chain logistics. Tracking a specimen from a decentralized home collection point all the way to the analysis lab requires protocol-specific kitting to ensure specimen viability. As trial architectures increase in complexity, relying on legacy supply chain models becomes an unacceptable risk. It is time to shift to custom engineering. This is where SunMed steps in. We are a specialized logistical partner built to execute advanced kitting and packaging solutions. Integrating with a dedicated partner ensures your study startup accelerates without sacrificing downstream data integrity. The process begins with a design consultation, where we map out the specific needs of your protocol. Every startup delay and reshipment cycle pulls another $55,000 a day from your budget. Take action today to protect your trial budget. For a custom kit design consultation, check the link in the description.